The next speaker, next presenter is Dr. Matt Trowbridge, Associate Professor, Emergency Medicine at University of Virginia. Thanks for joining us. And also he's the co-director of the Medical Design Program at University of Virginia. He set up the design studio in the medical school. Your studio looks like my studio. So I'm very excited. So Matt, the floor is yours.
Fantastic. Well, I'm going to start sharing my screen here. Okay, well, thank you so much. Yes, my name's Matt Trowbridge, Associate Professor, University of Virginia School of Medicine, and I direct what we call the UVA Medical Design Program. And essentially what we do is very simple. We teach design thinking to medical students, although I would say the aspiration is to go beyond that. We really think of ourselves as preparing to, just like we heard in the previous speaker, there's so many different parts of the healthcare profession that can be engaged in this way. So I know I'm preaching to the crowd here, but the reason we focus on design thinking is that we believe it provides a really valuable, and I would even dare to say necessary, framework for medical students, healthcare professionals, to take on human-centered and systems-based challenges in healthcare and public health. We think it's a great way, a very efficient way of helping to generate necessary mindsets, particularly things like tolerance of ambiguity and things like that. It also is a great introduction to core design skills and tools. And I think it's really one of its biggest things is it just, by giving students this opportunity to run through things in this way, I think it gives them creative confidence, as David Kelly would say. And essentially, we love, the reason we launched this program was we saw it as an opportunity for UVA and ourselves to kind of send a clear message to students that we kind of want, in fact, I would dare say expect them to kind of see themselves as taking on kind of wicked problems, systems-based complex problems in healthcare, excuse me, throughout their entire career. The way we do that is, it's great to hear from the previous speaker about this innovation that I think is really necessary, kind of figuring out how to hone down the whole thing that is design into very tangible, very fast, sprint style exercises, experiences, and workshops and tools that help these students who have no time to kind of try to jump in with us. And because med students, as you'll hear, I'm sure from Bon and everyone else, they will only engage with you if they feel like they're actually making a difference. So you can't just talk about stuff. You've got to be actually doing things. But how to do that in a time-constrained way is the educational challenge, but I think also part of the fun. So let me jump right into a very specific example. So like everyone here, in May and June, University of Virginia School of Medicine suddenly had to go virtual. And that meant that a lot of our fourth-year med students suddenly couldn't be on the clinical wards anymore. So we had to stand up a whole bunch of virtual electives. And I raised my hand and said, sure, let's do it. And we made a 5-day virtual design sprint, which I had never done before, on the issue of COVID-19. This happened in early June. We had 20 fourth-year med students jump in with us. And it's really important to note that only 2 of the students had actually taken my design course as first years. So these were really completely novice students. And one of the things we have learned that makes a big difference is to that idea of making an impact. Even if we don't actually get a lot of time to make tons of stuff, we always have a client. So we always have somebody at the core who's thinking about an issue day in, day out, and then those students kind of focus on helping them bring a new understanding to their issues. In this case, it's my colleague, friend, and actually co-director of the design program, Dr. Deborah Vinton, who is the medical director of our emergency department here. So she's in charge of all the clinical operations, and she's become very enamored with design thinking, first through her own business training. But she jumped in to be our client. And essentially what she challenged us with was basically pretty basic. How might we improve the patient and provider experience in the emergency department at UVA during COVID-19? And there were a whole bunch of things that got generated, but one of the really important topics that she asked us to think about was the issue of personal protective equipment, PPE. And most specifically, it was this, as we were moving into an era where this wasn't just going to be a short flash in the pan experience, but we had to kind of get into living with PPE. She really wanted to have people think about how might we make that, what does it mean to do this as a chronic part, an established long-standing thing, particularly from a provider perspective. So a couple of our students took this on, and I'm giving you, these are their slides and their presentation. So if you know from the Karate Kid, they went with the wax on, wax doff of donning and doffing PPE. And what you'll see is actually one of our artifacts, which is essentially, we found it very helpful to give students, we let them change their own graphic identity, I promise, Ellen, but we give them a structure of telling them how to build. Like if you only have 5 days, we help them work through day 1, 2, 3, 4, 5, and they're essentially building out this pitch by following the different pieces and handing off their thought process. So let me show you what I mean. So of course, the first thing we did was just have them do a very basic user journey map of jumping in, understanding what it's like to do as a provider has to deal with as they put on PPE. We just did like Google Slides, very basic stuff, letting them just kind of think about all the different steps that a person has to do to try to successfully just get PPE done one time and figure out where the positive, negative emotions are in that little journey. They came up with a whole bunch of things, but some of the things they came up with right away, just on their own evaluation of this, is that the donning and doffing procedures, they read them are long, they're tedious, and they're actually not that intuitive sometimes. The checklist is heavily text-based. There's no visual aspect about it. Also, they found that they just had a suspicion that this idea of finding a coach who has to confirm you did it right seemed like a bottleneck. But there were a bunch of other things, but those are some of the ones that really stood out to them. So then we asked them to do the classic analogous inspiration exercise. And the students had fun with this. They thought about kind of, what could you do? Infographic tutorials, airplane safety videos. Of course, they got into, well, we should go with the TikTok dance video concept. Is there something there? And then, obviously this is human-centered design. We took those kind of assumptions and brought them to user research. So we had them virtually interview a bunch of providers. We also were able to get patients who had to use the emergency department frequently, ask them what they felt had changed during COVID and how the PPE experience was from their perspective. And they came up with one of the things we've really emphasized with our students is that more than their end idea, we really try to engender in our program this idea that it's, again, the thinking along the way, the insights that they come up with are probably going to be their most valuable product for the client. And so we really focus a lot on this. So we really have them, we give them templates for talking about their insights and try to get them to name them with kind of punchy ideas and stuff. So for example, when they talk to providers, they kept finding that for all these protocols, there's these things like there's an exposed area on the back of your neck that kind of, if you're doing this over and over and you're really worried about bringing, infection back to your family and friends, that felt there was like these kind of gaps in the PPE. They also noted like contaminated shoes were a big thing. There were even some providers that kind of had a work car where they would kind of shed their stuff. And, that's obviously not a very extensible or a scalable solution, but that was the kind of thing that was going on in these providers. They also as the physicians started getting more comfortable, when they were honest, they said they were starting to get a little cocky. But at the same time, they were very aware that they were worried that in that speed and getting more routine, that maybe they might miss something really basic. For example, like we heard, like they were just forgetting like something silly that you think you would not forget, like putting on the goggles. That it actually, if that happens, you're immediately quarantined if you go into it. So we were losing like 20 ICU nurses because of something simple like that. Or forgetting that bleach wipes can leave you stranded in a room while you wait. It also was clear that when the small change in the protocol happened, it was all text-based, and it was really hard to know what had changed in the procedure because it was all just text. And then there was just this cumulative mental tax that everybody talked about of it's just exhausting to keep having to do this over and over. So from there, we took these ideas and let them do some prototypes. We always refer to them as sacrificial concepts, like to try to not have them be too overly wed to any one particular idea. But some of the fun things that this group came up with, they came up with this idea of having like mirrors in the hallway that had kind of the most basic aspects of the PPE thing, the goggles and stuff kind of printed on it. So that you could just, as a final last check, you could just stand in front of the mirror and make sure you got all your basic things. To address the back of your neck thing, they also said maybe we could put one of those rear view mirrors that you could check behind you and make sure you hadn't made a dumb mistake behind you. They also had this idea of rebranding, that kind of necessary few minutes where you're washing and stuff, that maybe we could rebrand it as a moment for meditation or something like that, for that kind of cumulative mental tax part. They said, well, we got to gamify this. Like, physicians, nurses, pharmacists are all very competitive people. So, there should be some sort of way of gamifying like perfect PPE performance in some form. And they also had some more outrageous ideas like the auto donor, where you could just, jump in. But it actually generated some interesting things about things like even like that shoe concept of for dealing with things like the contaminated shoe problem. So overall, it was a really successful sprint, and the client was thrilled. From here, kind of like you heard from the other speakers, I think we are excited to actually just lean into virtual. We feel like we're rapidly trying to develop workshops for. This is our first experience working with more experienced students. Most of our students are at first years, so that was exciting, and we're continuing to build that out. We're leaning into virtual, as I said, trying to come up with more flipped classroom models that I think will probably extend beyond the COVID. And honestly, for this crowd, whether you're in the program or my fellow speakers, our vision, we'd like to contribute, because I know we're not the only ones doing this, to some sort of open source kind of health design thinking resources, because I think there's a lot there, and I want to be part of it. So thank you so much. Please join us and reach out. We'd love to talk with you. The students really are amazing. So we'd love to join with you in any way we can. So thanks so much. Really appreciate the time.
Thank you very much, Matt. It was fascinating, and I wish I had a mirror. I need a mirror like that in my house. People, I live a house. So yeah, I think it's very interesting. I think you guys did a very good job. Usually, when at the very beginning, I mentioned that design thinking should be human experience center, not just human center, human experience center. And your students pay attention to not just physical experience, but psychological, mental experience. That's really a key to the success of design thinking. That's wonderful. Thank you so much.